Our sense is that all Canadians are equal and equally deserving of the health care that they need.
That statement by Dr. Carl Stobbe goes a long way towards understanding the mission of Reach Niagara. The source spent some time with the Reach team to get a better understanding of the challenges faced by the frontline care team and the marginalized population they serve. What's been the biggest eye-opener for you since the mobile clinic first hit the road?
Well, we've been looking after people within homeless shelters for the previous 3 years when we started with the mobile clinic. And there's a few things that have been quite unique with it. One is just the visibility. So when we have a clinic in a shelter, the people in the shelter know, but the people in the neighborhood not so much. And here we're getting people from the general vicinity who are also poor, marginally housed, or homeless, coming in, and some of them I don't even know their address, some of them don't have an address, and they're still coming regularly for health care because they know we're going to be here on the same day at the same time.
So this is the 14th unit that TELUS Health for Good, that program, has built, and every time they find a better way to do it. I called TELUS, I believe, in September of 2019. And it was March of 2021 that we got the answer. So it was a long time. And we had to build a case, and it wasn't necessarily an application, we just had to build a case to say, hey, listen, this is a very large region. Homelessness is, it's everywhere. People need help, and this will help us do that.
I've been in this neighborhood my whole life, and they're needed here. It's like people are living in tents down here now. Right? They're fantastic. Actually, the first people who listened to what I had to say before, without kind of give me that. So.
Is that important to you?
Yeah. People need to feel listened to.
What are some of the healthcare barriers that your patients face?
Well, one of the biggest ones in the setting of homelessness is having difficulty keeping track of time. They lose their possessions, they lose their belongings, any notes or calendars that they might have, they lose. A lot of times their phones don't work because they can't afford the airtime. And so they have real trouble keeping appointments. And that is a huge issue with healthcare because all of healthcare is appointment-based. And so what we've been doing, both in the shelters and on the mobile unit, is we come to the same place for a half day every week, all the time. So as long as people remember Thursday afternoons, I'll be here, they come back and they just wait till it's their turn. And they've been so gracious and patient with when there's other people that are in line ahead of them. So it's been fascinating. The appointments are the main thing, and then we get into things like transportation, fear. Some people have been traumatized by various elements of the healthcare system. But I would say that for the kind of work we do, it's the appointment issue.
If you can imagine if you were unhoused and living rough in the community and you were going to a busy emergency room, you haven't maybe showered in a few days, you maybe you don't have clean clothes on, maybe you've been there before and you've been treated by other staff members or people, or you just feel that you're being judged by your current situation. So there definitely the bias and the stigmatism that's around is definitely one of many reasons why individuals don't seek health care. They could have past trauma, past fears. So there's so many different reasons.
I think if we approach people with respect and listen and remove the sort of traditional patriarchal approach to providing health care, especially recognizing that many of the folks we serve have experienced a lot of trauma. They're anxious about interacting with health professionals. So if they can leave feeling like we've made a connection and that they feel like in the future they feel safe and comfortable coming back when they have a health problem, I feel like I've really achieved something.
And I know Dr. Stobbe has a tremendous amount of support for the community, but we could always use more. So if there's an opportunity to figure out how you can support REACH, it really is doing the important work in our community to get to the most vulnerable and get them into a better pathway for healthcare recovery and hopefully long-term lifestyle recovery as well.
I encourage people to go to our website. I would encourage people to visit some of the sites where we're located to learn more. And perhaps if you want to volunteer or you want to help us fundraise, love to hear from you. It takes a lot to keep this thing going.
In Niagara, you're watching The Source on your TV.